To measure for the flex knee, you're going to begin at the center of the knee, right where it bends, right in the middle of that hinge. Go from there with your measuring tape to about the greater trochanter, or where your hip hinges. From there, you're going to take about half of that and take into consideration anything that's going on between their thighs. They might have adult tens, any bulk that would affect the length. But measure the circumference at that area. The length of our knee splint is much more important than the circumference. The circumference is pretty forgiving. The length affects your ability to get really good therapeutic value. It needs to be long enough for good leverage. Too short and you might set up a potential pressure problem behind the thigh and calf, especially if someone has a lot of spasticity or tone. Go from the knee down to the outside ankle, the lateral malleolus, and again about halfway. That's a rule of thumb. And the circumference at that area. Remember, it's always better to go long than short.